Hello everyone, welcome to another presentation of our life-changing work here at London Dental Specialists. I want to reassure you that you have come to the right place if you're looking for a smile improvement solution. If you like our videos, please subscribe to our YouTube channel and follow us on social media at London Dental Specialists. So let's get into today's presentation. It is about a 56-year-old gentleman who worked as an electrician, was medically fit and well, and had been walking around with teeth that he just was not proud of. He was mortified by the appearance of his teeth. So let's have a look. The first thing, as you can see, his teeth are just really heavily stained. The other thing that he did not like was this false tooth that was placed to replace a long-standing missing teeth. I think he said he actually was not born with that particular tooth, this upper left lateral incisor. And the other thing was that he had quite severe wear of the internal aspect of his upper front teeth. As you can see into the dentine of those teeth. So the first thing we did was whiten his teeth and remove that ugly looking front tooth. And you can see it here, his teeth look much better, don't they? Much whiter, and now the gap is now essentially visible. The other thing to notice is that some of his, or a couple of his lower back teeth are also missing. So it's always important to assess, well, have they contributed, to the fact that his upper front teeth are this worn. And in his particular case, not really, because the diagnosis of his wear, the reason why the wear occurred was not because of clenching or grinding, but it was because of the acid in his diet. He told me that he was a big fan of the big 2-liter bottle of Coke on a daily basis. To which I said, well, that's what the 2-liter bottle has done to your teeth. And if you plan on keeping whatever solution I give you, if you plan on keeping it for the rest of your life, then that's the very first thing that needs to completely go. And in fairness to him, the moment I mentioned that to him, he told me that he completely cut it out. So how did we actually improve this gentleman's teeth? The very first thing we did was, instead of the ugly looking bridge that he had before, I placed a dental implant, which you can see up there. And the most important bit of work that we need to look at in this gentleman's case are the backs of his upper front teeth. And obviously the backs are not visible, but if we're going to keep those teeth for as long as possible, then we need to reinforce them, because it's the back that is the biting contact. And as you can see here, right, I have built up the backs with some composite veneers that were made in the lab. They look absolutely beautiful. You can also see this implant tooth, and the gap that the patient had because of that missing tooth was a bit too big. So I put the dental implant here, and you can see this little gap here, and I filled that little gap with a white filling material. So I built the tooth behind the gap, I just built it a little bit more to bring it into contact, and as you can see, his teeth look absolutely beautiful from the inside. Now, let's look at the way the teeth looked at the outside. First, this is where he started. Look at those heavily stained teeth with that really ugly looking false tooth up there. Look at the beautiful, absolutely beautiful set of teeth afterwards. I was really proud of this case. What did we do here? We brought the composite bonding right over the front surface of his teeth, and as you can see, the dental implant over there. This is how he started, and look at that smile. Look at that beautiful beaming smile. He was absolutely ecstatic. And interestingly, this case only really took 4 months. And it took 4 months because of the dental implant. The dental implant is what delayed us. If we didn't have to do the dental implant, it would have probably taken about 6 to 8 weeks, start to finish. So please don't suffer in silence. There is no reason why you should be like my patient who went for years with teeth like that. He told me he wished he had done it years and years ago. Pick up the phone or get your dentist or your dental therapist to send you over to see us so that we can create this beautiful smile for you as well. It's a very simple case here with a single dental implant, some composite bonding, some composite veneers on the inside, not the outside of the teeth. And as you can see, this patient is absolutely ecstatic. And guess what? So will you. Thank you very much.